Online training. Myself Nikita. So today we're going to start with ICD-10-CM Chapter 21, factor influencing health status and contact with health services. And code ranges are Z00 to Z99. Okay. So topics covered in this class are introduction, ICD-10 coding guidelines. First guideline will be use of Z codes in any healthcare setting. Then second is Z codes indicate a reason for an encounter, and C is categories of Z codes. Okay, and lastly we'll see question and answers. So what are Z codes? Do you know anything about Z codes?
No, really, I don't have any idea.
No problem. So Z codes are codes found in chapter 21, factor influencing health status and contact with health services, Z00 to Z99. This is the code range for this chapter, okay, of the ICD-10 coding manual. Categories Z00 to Z99 are used in circumstances other than an encounter for disease, injury, or external cause of morbidity. The code ranges are A00 to Y99. These are starting chapters of ICD-10-CM. So we need to code other circumstances other than disease, injury, and external causes of morbidity using Z00 to Z99. Like some screening happen or pre-operative examination happen or some vaccination in other health status or something, we have to code from Z codes. We call it as Z codes. Okay. Then they indicate a reason for encounter or provide additional information about a patient's encounter. Sometimes, mostly history codes also starts with Z code only. Okay, Z later. Personal history, family history, or any other history. Okay. So these are Z codes. We'll see different guidelines for Z codes. First guideline, use of Z codes in any healthcare setting. Z codes are for use in any healthcare setting. Z codes may be used as either a first listed diagnosis, first listed means principal diagnosis code in the inpatient setting, or secondary code, or depend on circumstances of encounter. Sometimes if encounter is for pre-operative examination, then in that time you have to code particular Z code as a primary diagnosis or principal diagnosis. In case of inpatient setting, we call them as principal diagnosis, which we sequence first. We need to sequence first. Okay. Sometimes if we need to sequence them as a secondary code, or sequencing is depending on circumstances of encounter. Certain Z codes may only be used as first listed or principal diagnosis, just as I say pre-operative examination and all. So B point, Z codes indicate a reason for an encounter or provide additional information about patient encounter. Z codes are not procedure codes. These are not procedure codes. Okay. So a corresponding procedure code must accompany a Z code to describe any procedure performed. Next guideline, categories of Z codes. Contact and exposure. Category 20 indicate contact with and suspected exposure to communicable diseases. Okay. So Z20 indicate contact with or suspected exposure to or communicable diseases. Okay. So these codes are for patients who are suspected to have been exposed to a disease by close personal contact with an infected individual, or are in an area where disease is epidemic. Okay. So in such cases, we have to use Z20. Category Z77, other contact with an suspected exposures hazardous to health, indicates contact with and suspected exposures hazardous to health. So Z20 is for contact with for those patient who are suspected to have exposure to disease. Okay, and Z70 77 is for other contact or suspected exposure to hazardous to health, indicate contact with and suspected exposure to hazardous to health. Okay. Contacts or exposure codes may be used as a first listed code to explain an encounter for testing, or more commonly as a secondary code to identify a potential risk. Okay, so these codes G20 or G77 are used as a first listed diagnosis to explain an encounter for testing, or more commonly as a secondary code to identify potential risk. Next type of G codes are inoculations and vaccinations. So code G23 is for encounter for inoculations and vaccinations. Okay, just give me a minute and highlight this. Okay, so code G23 is for encounters for inoculations and vaccinations. You have to at least remember this starting 3 letters of each and every section. Okay, so it will be easy for you to find out the code. It indicates that a patient is being seen to receive a prophylactic inoculations against a disease. Code G23 may be used as a secondary code if the inoculation is given as a routine part of preventive healthcare, such as well baby visit. Okay, so G23 we use for vaccination. If you get any question regarding vaccination or immunization, you have to go through G23 series. Then next point is status codes. Status codes indicate that patient is either a carrier of a disease or has the sequelae or residual effect of a past disease or condition. This includes such things as the presence of prosthetic or mechanical devices resulting from past treatment. So status codes mostly represent if any surgery happened to that patient, or any prosthetic or mechanical device which is a resultant of any past treatment or any past disease. Okay, so that we call as a status code. The status code is informative because the status may affect the course of treatment and its outcome. So these codes are mostly informative codes, status codes, because they will provide information about previous encounters or patient's history, which may affect treatment and its outcome. The status code is distinct from a history code. These are not same as a history code. Okay, personal history, private or family history codes are different codes. Those are also start with G codes. Status codes and history codes are different. The history code indicates that patient no longer has the condition. Okay, but status code we use when that patient currently has that particular condition, like if presence of prosthetic device, mechanical device. Okay, that history code we use when that particular condition is no longer present. The status codes, status G codes, we'll see. These all now I'll show you are status code. Okay, so first is G14. G14 is for genetic carrier. Genetic carrier status indicates that a person carries a gene associated with a particular disease, which may be passed to offsprings who may develop that disease. Okay, the person does not have the disease and is not at risk of developing the disease. Okay, so G14 category is for genetic carrier. Second, G15. G15 is for genetic susceptibility to disease. Genetic susceptibility indicates that a person has a gene that increases the risk of that person developing the disease. Okay. G14 is for genetic carrier, which state that that person carries some gene associated with particular disease. But G15 is for genetic susceptibility to disease. So G16 is for resistance to antimicrobial drugs. This code indicates that a person has a condition that is resistant to antimicrobial drug treatment. Sequence the infection code first. when you need to use Z16 code, resistance to antimicrobial drug, you need to sequence infection code first. First you need to code infection code, then you have to use Z16 code. Next, G17, estrogen receptor status. G18 is for retained foreign body fragment. G19 is for hormone sensitivity malignancy status. Next is G21. G21 is for asymptomatic HIV infection status. This code indicates that a patient has tested positive for HIV but has manifested no signs or symptoms of the disease. Okay, so G21 is for asymptomatic HIV infection status. We'll see how to use this G21 code when we see the guidelines related to HIV infection. Okay, don't worry about it. Then next point is G22, carrier of infectious disease. Carrier status indicates that a person harbors the specific organisms of a disease without manifest symptoms and is capable of transmitting the infection. Okay, so G22 we use to indicate that particular person is carrying specific organism of specific disease. Okay, maybe that person is not showing any symptoms, but he or she will be capable of transferring or transmitting that infection to other persons. Next category is G28.3, under immunization status. This course we mostly use in case of COVID-19 infections. Okay, COVID-19 immunization. G33.1, pregnant status incidental. This code is a secondary code only for use when pregnancy is in no way complicating the reason for visit. Otherwise, a code from Obstetric chapter. Okay, if pregnant state incidental means pregnancy is no way complicating the reason for visit. In that case, you have to use G33.1. Okay. Next, G66. Do not resuscitate. Okay. This code may be used when it is documented by the provider that a patient is on do not resuscitate status at any time during the stay. G67, blood type. G68 is for body mass index, BMI. BMI codes should only be assigned when there is an associated or reportable such as obesity. Do not assign BMI codes during pregnancy. We should not use BMI codes during pregnancy, and we have to use BMI only when there is an associated reportable diagnosis. Okay, such as mostly in case of obesity, we have to use BMI codes. How to use these codes and all, we'll see later on. G78.01, bed confinement status. G76.82, awaiting organ transplant status. Next is G78, other specified health status. Code G78.1, physical restraint status may be used when it is documented by the provider that a patient has been put in restraint during the current encounter. Please note that this code should not be reported when it is documented by the provider that a patient is temporarily restrained during a procedure. Okay, we have to use G78.1 code only when patient has restraint status. G79, long-term or current drug therapy. Codes from this category indicate a patient's continuous use of prescribed drug, including such things as aspirin therapy, for the long-term treatment of condition or for prophylactic use. It is not for use for patients who have addicted to drugs. Okay, if patient is addicted to drug, we should not use this code. When patient needs to use those certain drug or any therapy for drug therapy, okay, for long term, for at least since 6 months, we can code them using G79 category. This subcategory is not for use of medications for detoxification or maintenance programs to prevent withdrawal symptoms. For example, methadone maintenance for opiate dependence. Assign the appropriate code for the drug use, abuse, or dependence instead. Okay, if drug use or drug abuse or drug dependence is there, in that case you have to use drug use, drug abuse, or drug dependence codes. Okay, but if patient is using a particular drug for long-term drug therapy and currently also using the same drug for drug therapy, in that case you have to use G79. Next, G88, allergy status to drugs, medicaments and biological substances. Except Z88.9, which is for allergy status to specific drugs, medicaments and biological substances status. Next, Z89, acquired absence of limb. 90 is for acquired absence of organs not elsewhere classified. Z91.0, allergy status other than to drugs and biological substances. Z92.82, status post administration of TPA or RTPA in a differential facility within the last 24 hours prior to admission to a current facility. Assign code Z92.82, status post admission of TPA or RTPA in a different facility within the last 24 hours prior to admission to current facility as a secondary diagnosis when the patient is received by transfer into facility and documentation indicates that they were administered tissue transminogen activator, means TPA, tissue transminogen activator, within the last 24 hours prior to admission to the current facility. So for status post administration of TPA, we have to use G92.82. Next, G93 is for artificial opening status. G94 is for transplanted organ and tissue status. G95 is for presence of cardiac and vascular implants and grafts. G96 is for presence of other functional implants. G97 is for presence of other devices. G98 is for other post-procedural status. Assign code G98.85, transplanted organ removal status. Okay, G98.85 is for transplanted organ removal status to indicate that a transplanted organ has been previously removed. Okay, this code should not be assigned for encounter in which the transplanted organ is removed. Okay, so we should not use Z98.85 code for the encounter in which transplanted organ is removed. Okay, we have to use Z98.85 to indicate transplanted organ removal status. Okay, the complications necessitating removal of transplant organs should be assigned for that encounter. G99 is for dependence on enabling machines and devices not elsewhere classified. And note that Z89 to Z90 and Z93 to Z99 are for use only if there are no complications or malfunctions of the organ or tissue replaced. Okay, if any complication is there, we have to use complications code. If there is no complication, we can use Z89 to Z90 series and Z93 to Z99 series. The amputation site or the equipment on which the patient is dependent. Next category is history of the history codes. There are two types of history or history Z codes, personal and family. So we have separate codes for personal history and we have separate code for family history. So while you assigning code or selecting code for any history of related to any disease, okay, make sure that you are reading that question or your report properly, whether that is personal history or family history. Okay, and select code accordingly. Personal history code is a patient's past medical condition that no longer exists, okay, and is not receiving any treatment, but that has the potential to reoccurrence and therefore may require continued monitoring. Okay, so we have to use personal history code only in that case when there is when that particular medical condition is no longer exist, or that patient is no longer receiving any treatment related to that condition. Okay, but that condition has potential to reoccurrence and therefore we need to monitor that patient. That's why we need to assign personal history code. Okay. Next, family history codes are for use when patient has a family member who has had a particular disease that causes the patient to be at higher risk of also contracting the disease. Okay, so in case of family history of cancer or breast cancer or any heart diseases, we need to code. Personal history codes may be used in conjunction with follow-up codes, and family history codes may be used in conjunction with screening codes to explain the need for a test or procedure. So personal history codes we need to use in conjunction with follow-up codes, and family history codes we need to use when in case of screening. Okay, when we use screening codes like mammogram or any cancer-related screening to explain need for test or procedure. History codes are also acceptable on any medical record regardless of reason for visit. Okay, so history code you can assign on any medical record regardless of reason for visit. The reason for encounter, for example, screening or counseling, should be sequenced first, and the appropriate personal and or family history code should be assigned as additional diagnosis. Sorry. A history of an illness, even if no longer present, is important information that may alter the type of treatment ordered. Okay, certain history related to certain illness, even if that is no longer present, but information about that particular illness or condition is important because that may alter the type of treatment order. Okay, and if reason for encounter, for example, screening or counseling is there, we should sequence those codes first. Okay, and appropriate personal and family history code should be assigned as a additional diagnosis. So these are some examples of history codes. Z codes. Z80 is for Z80 category is for family history of primary malignant neoplasm. G81 is for family history of mental and behavioral disorders. G82 family history of certain disabilities and chronic diseases. So these are some examples of family history codes. Personal history codes are also there. G85 is for personal history of malignant neoplasm. G86 personal history of certain other diseases. G91.81 is for history of falling. G91.82 is for personal history of military deployment. So these are few examples of history codes, personal and family history. Next category is screening. Just a minute. Do you have any doubt?
Yeah, no, Nikta.
So next point is screening.
1 second, Nikta. Do we need to?
Next point, screening. Screening is the testing for disease or disease in seemingly well individuals so that early detection and treatment can be provided for those who test positive for the disease. For example, screening mammogram. So screening is the testing for disease or for well individuals so that early detection and treatment can be provided to those people. Okay, the testing of a person to rule out or confirm a suspected diagnosis because the patient has some sign or symptoms is a diagnostic examination, not a screening. Okay, if testing for a person to rule out or confirm a suspected diagnosis because patient has some sign and symptoms. In that case, we call that examination as diagnostic examination. Okay, but if we are what I can say, we are examining the person for some diseases, okay, for early detection and treatment, that we call as screening, okay, like screening mammogram. So, in case of a diagnostic examination, in these cases, the sign and symptom is used to explain reason for the test. So, if diagnostic examination is there, in that case, we have to use sign or symptoms to explain reason for the test. But if it is screening, just a screening, we just doing that examination for early detection of particular disease like breast cancer. We did screening mammogram. Okay, so in case of screening mammogram, we should not use any other sign and symptom scores because that person with present without any sign and symptoms. So we need to use only G codes for screening in case of screening mammogram. But if it is diagnostic mammogram, we have to use sign and symptoms because that patient present with sign and symptoms only. A screening code may be a first listed code if the reason for the visit is specifically the screening exam. Okay, screening code we have to use as a principal or first listed diagnosis if the reason for encounter is screening exam. Okay. It may also be used as an additional code if screening is done during office visit for other health problem. Okay, we can use screening code as a secondary or additional code if that screening is done during other health problem while checking other health problem. A screening code is not necessary if the screening is inherent to a routine examination such as pap smear done during a routine pelvic examination. In such cases, your screening code is not necessary. Okay, if the screening is inherent to routine examination. Okay, you will get all the guidelines below that particular code only. Okay, that if you need to use that screening code or if you no need to use that code, you'll get all the guidelines. How to use screening codes, that we'll see. This is the flow chart. First, you need to ask yourself one question. Does the patient have a sign or symptoms that prompted the test? If the answer is yes, the report the sign or symptoms that prompted the test. If patient present with sign and symptoms, okay, in that case you have to use sign and symptoms. But if patient is not present with any sign and symptoms, in that case you have to use screening code. If the condition is discovered during the screening, the code for the condition may be assigned as an additional diagnosis. If any condition is discovered during screening examination, you can code that condition additional. But primary code you must use is screening code. If the reason for encounter is screening. Okay, and if a patient present with any sign and symptoms, you have to use sign and symptoms. So this is in case of diagnostic screening, diagnostic test. The Z code indicates that a screening examination is planned. A procedure code is required to confirm that screening was performed. The screening Z code categories are: G11 is for encounter for screening for infectious and parasitic diseases. G12 is for encounter for screening for malignant neoplasm. G13 is for encounter for screening for other diseases and orders and disorders except G13.9, which is for encounter for screening unspecified. Okay, and G36 is for encounter for antenatal screening for. So when screening mammogram is there, screening mammogram is we use for screening breast cancer. Okay, in that case you have to use, if screening mammogram is there, you have to use G12 as a principal diagnosis. This is important code. Please make a note of it. G12 is for screening mammogram. Means this category we have to use for screening malignant neoplasm, and you will get screening mammogram code in this category only, G12. Okay, I'll show you different codes. You can see here, encounter for screening malignant neoplasm. Okay, so many codes are there. G12.10 unspecified, G12.11 encounter for screening for malignant neoplasm of colon, rectum, small intestine, and you can see here G12.3 encounter for screening for malignant neoplasm of breast. Okay, so G12.31 encounter for screening mammogram for malignant neoplasm of breast, and G12.39 encounter for other screening for malignant neoplasm of breast. So if you get any report or any question related to screening mammogram, in that case you have to use G12.31 code. Please make a note of this code, G12.31, and it will be better if you remember this code. Okay, you can get this code very easily, but it will be better if you remember this code, G12.31. Screening, encounter for screening mammogram of breast, neoplasm of breast. Next, observations. There are 3 observation Z code categories. They are used for very limited circumstances when a person is being observed for a suspected condition, that is rule out. Okay. The observation codes are not for use if an injury or illness or any sign or symptoms related to the suspected condition are present. Okay, the observation Z codes are used in very limited circumstances when patient is being observed for suspected condition. Okay, that is rule out. And the observation codes are not for use if injury or illness or any sign or symptoms related to suspected condition are present. Okay, because in that case you have to code sign and symptoms of particular injury or illness. In such cases, the diagnosis symptoms is used with corresponding external cause. So the observation Z codes categories are G03 encountered for medical observation for suspected diseases and conditions rule out. G03 is for encounter for medical observations for suspected diseases and conditions rule out. G04 encounter for examination and observation for other reasons except 4.9, which is for encounter for examination and observation for unspecified reason. G05 is for encounter for observation and evaluation of newborn for suspected diseases and conditions. So these are categories for observation Z codes. And please remember that if sign and symptoms are there, we have to code sign and symptoms only. Okay. Next, aftercare. Aftercare visit codes cover situations when the initial treatment of a disease has been performed and the patient requires continued care during the healing or recovery phase or for the long-term consequences of the disease. So aftercare codes we have to use only in that situation when initial treatment of disease is already performed, but patient require continued care for long-term consequences of disease. Okay. The aftercare Z codes should not be used if treatment is directed as a current acute disease. The diagnostic code is to be used in these cases. If the treatment is directed at a current and acute disease, we have to use diagnosis. Okay, but treatment is already completed. In that case, we have to use aftercare. Okay, and if treatment is directed at current and acute condition, in that case, we have to use diagnosis code. Exceptions to this rule are code G51. G51.0 is for encounter for anti-neoplastic radiation therapy, and codes from subcategory G51.1 encounter for anti-neoplastic chemotherapy and immunotherapy. Okay, there are other guidelines also to use these codes for encounter for anti-neoplastic therapy encounter for neoplastic chemotherapy, immunotherapy. Okay, that we'll see when we see the neoplasm chapter. The codes are to be first listed, allowed by diagnosis code when the patient's encounter is solely to receive radiation therapy, chemotherapy, or immunotherapy for the treatment of the neoplasm. Okay, so we have to use these codes, G51 codes, okay, as a first listed or principal diagnosis, followed by particular diagnosis code. Particular diagnosis means obviously it must be neoplasm only, because chemotherapy done in case of neoplasm. So, but when we need to use this G51 code as a first listed, when encounter is solely to receive either radiation therapy or chemotherapy or immunotherapy for the treatment of neoplasm. Okay. If the reason for encounter is more than one type of anti-neoplastic therapy, code G51.0 and a code from subcategory G51.1 may be assigned together. Okay. In which case one of these codes would be reported as a secondary diagnosis. So, if the reason for encounter is more than one type of anti-neoplastic therapy, you can use either of these one Z code as a principal and one of the code as a secondary diagnosis. Okay, if the encounter is for anti-neoplastic therapy only. So G51 category represent encounter for anti-neoplastic therapy, and we have separate code for neoplastic therapy, radiation therapy, anti-neoplastic chemotherapy, and immunotherapy also. So make sure that you will be selecting right code. The aftercare G category codes. These are some categories of aftercare code. G42 is encounter for plastic and reconstructive surgery following medical procedure or healed injury. G43 encounter for attention to artificial openings. Okay. G47 is for orthopedic aftercare. G51 is for encounter for aftercare and medical care. Next category, follow-up. The follow-up codes are used to explain continuing surveillance following completed treatment of a disease, condition, or injury. Okay. They imply that the condition has been fully treated and no longer exists. Okay. When patient comes for follow-up, just to check whether that condition has fully means after completion of full treatment, when just patient come for follow-up, we have to use follow-up codes. They should not be confused with aftercare codes or injury codes with a seventh character for subsequent. Okay, what is this seventh character and all that we'll see later on in other chapters. Okay, that explain ongoing care of a healing condition or its sequel. Seventh character we use in ICD course to explain ongoing care of a healing condition or its sequel. Okay. Follow-up codes may be used in conjunction with history codes to provide the full picture of a healed condition and its treatment. The follow-up code is sequenced first, followed by history code. When you need to use two codes, follow-up codes and history code, you need to sequence follow-up code first, then history code. These are some follow-up codes category. G08 is for encounter for follow-up examination after completed treatment for malignant neoplasm. G09 encounter for follow-up after completed treatment for conditions other than malignant neoplasm. G39 is for encounter for maternal postpartum care and examination. Okay, so these are some categories of follow-up codes. Next category, donor. Codes in category G52. 52 is for donors of organ and tissues. Okay, are used for living individuals who are donating blood or other body tissue. Okay, not used to identify cadaveric donations. Okay, so this G52 code, which is used for donor of organs and tissue, we have to use this G52 code on living individuals only. Okay, not for identifying cadaveric donations. These codes are for individuals donating for others as well as for self-donation. Next category, counseling. Counseling Z codes are used when a patient or family member receives assistance in the aftermath of an illness or injury, or when support is required in coping with family or social problems. Okay? So we have the codes for counseling also. Some examples are G30.0 is for encounter for general counseling and advice on contraception. Then G31.5 encounter for procreative genetic counseling. G32.3 is for encounter for childcare instructions. G69 encounter for mental health service for victim or perpetrator of abuse. G71 persons encountering health services for other counseling and medical advice not elsewhere classified. G71.87 encounter for pediatric to adult transition counseling should be assigned when pediatric to adult transition counseling is the sole reason for the encounter, or when this counseling is provided in addition to other services such as treatment of chronic condition. If the both transition counseling and treatment of medical condition are provided during the same encounter, the codes for medical condition treated and code G71.87 should be assigned with sequencing depending on circumstances of encounter. Okay. If the reason for encounter is medical condition, you have to code medical condition as a principal or first listed diagnosis, and then you have to use code for G71.87. And if the reason for encounter is counseling and plus that patient also has some chronic condition or any other medical condition, you have to assign G71.87 as a principal diagnosis, and then followed by medical condition. So in most of the cases, the sequencing is depending on reason for encounter. Okay, in most of the cases in medical code, we have some exceptions to this guideline, but this is common guideline that we have to use first listed diagnosis for that condition which is actual reason for encounter. Okay, G76.81, which is for acceptant mother pre-birth pediatrician visit. Next is encounter for obstetric and reproductive services. Just a minute. So G codes for pregnancy are for use in those circumstances when none of the problem or complications included in the codes from the obstetric chapter, okay, the routine prenatal visit or postpartum care. If there is no complication related to pregnancy or postpartum period, we can use G codes. Okay, if there is no any problem or complications present. Codes in category G34 encounter for supervision of normal pregnancy are always first listed and are not to be used with any other code from OB chapter, it's pregnancy chapter. Okay, so codes in category G34 encounter for supervision of normal pregnancy, as this code itself indicate that this is used for supervision of normal pregnancy. Normal pregnancy means any pregnancy without any complication. Okay, without any single complication. That's why we need to use this code as a first listed and or not to be used with any other code from category OB, from OB chapter, okay, because OB chapter consists codes for complications, pregnancy related complication. Okay, so if you need to use OB chapter codes, it means that patient has certain complications. So there is no point of using this supervision of normal pregnancy code, right? You have any doubt?
No, Nikita. Yeah, good. No.
So please remember this point Okay, this is also important point. G34 is for, and it will be better if you remember this code. G34 encounter for supervision of normal pregnancy. Please make a note of it when I am saying this is important.
Okay.
Okay. Code in category G3A, weeks of gestation. G3A, weeks of gestation, may be assigned to provide additional information about the pregnancy. Category G3A codes should not be assigned for pregnancies with abortive outcomes, category O002, O08, or elective termination of pregnancy, okay, code G33.2, nor for postpartum conditions, as category G3A is not applicable to these conditions. So G3A code again we have to use to indicate weeks of gestation. We'll see all these codes when we going through pregnancy chapter. Okay, but please remember this thing that G3A code, which is for weeks of gestation, we have to use to provide additional information about pregnancy, and we should not use G3A code in case of abortive outcomes or elective termination of pregnancy or in case of postpartum conditions. Okay, when patient is pregnant, in that case only we have to use G3A code to represent weeks of gestation. How to use this code and all, we'll see when we saw the pregnancy related guidelines. The date of admission should be used to determine weeks of gestation for inpatient admissions that encompasses more than one gestational week. This guideline also we'll see in pregnancy chapter. The outcome of delivery, category G37, should be included on all maternal delivery records. It is always a secondary code. Okay, G37, which is for maternal delivery record, outcome of delivery. G37 represent outcome of delivery, should be included on all maternal delivery records. Okay, when delivery happen, actual delivery happen, on that report only we have to use G37 code, and this is always secondary code. We should not use this code as a primary code, because obviously when delivery happens, we have to use the first code for normal or cesarean delivery or any complication related to delivery. Okay, and after that we have to use this code G37 to represent outcome of delivery. Okay, so in case of pregnancy, these are important codes. Please make a note of it. G34 is for encounter of supervision of normal pregnancy when there are no any complication present. Okay, just normal pregnancy supervision is there. G34, G3A to represent weeks of gestation. Okay, when patient is pregnant. Okay, in that case we have to use G3A to represent weeks of gestation, and when actual delivery happens, in that case on that report only. So G37 code we have to use only once during the pregnancy. Okay, when actual delivery happens, G37 to represent outcome of delivery. Okay, done. Is it clear? Is it clear?
Yeah, yes.
Please make a note of these three codes. These are
I did.
important codes, and you always remember this code. Okay, go through this code and guidelines again and again, so it will be by heart. Next category: newborns and infants. Providers define newborn and infant Z codes as before birth through the 28 days following birth. Okay, so we have to use this G codes before birth through 28 days following birth. Okay, these codes are not for use on maternal records. Codes for newborn and infant we should not use on maternal record. For maternal record we have separate codes that just we go through. Okay, and these are appropriate to use throughout the life of the patient as long as the condition is still present. Newborn Z codes categories are G76.1, encounter for health supervision and care of foundling. Okay, G00.1, encounter for routine child health examination. G38, live born infants according to place of birth and type of delivery. Like just we saw G37 code, outcome of delivery. Of delivery code G37 we have to use on maternal reports only. This is also to be noted that G37 use only on maternal report, okay, and G38 we have to use only on newborn record, depending on place of birth and type of delivery. Cesarean delivery, normal delivery. G37 is for maternal record, G38 for newborn record. This code also we have to use only once on the newborn record, like G37. Don't get confused between these two codes. Okay. Next point, routine and administrative examinations. The G codes allow for the description of encounters for routine examinations such as a general checkup or examinations for administrative purposes such as a pre-employment physical. Okay. The codes are not to be used if the examination is for diagnosis of a suspected condition or for treatment purposes. So, routine and administration examination code we have to use just only for general checkup or examination for administrative purposes. Okay, we should not use these codes or if the examination is for diagnosis of suspected condition or for treatment purpose. Okay, for that we have separate codes. During a routine exam, a diagnosis or condition be discovered. Pre-existing and chronic conditions and history codes may be coded as additional codes as long as the examination is for administrative purposes. Okay, if the examination is for administrative purpose and in that examination, if we diagnose that patient some diagnosis or any condition, or if any pre-existing or chronic condition or any history is there, we have to code them additionally. But if encounter is for administrative purpose examination, we have to use administrative examination. The categories are or examples are G00 encounter for general examination without complaint, suspected or reported diagnosis. G01 encounter for other special examination without complaint, suspected or reported diagnosis. G02 examination for administrative examination except G02.9 encounter for administrative examination unspecified. Okay, and G32.0 encounter for pregnancy test. These are also important codes. Okay, G00 for general examination without complaint. Okay, G01 other special examination without complaint. G02 encounter for administrative examination and G32 encounter for pregnancy test. Next, miscellaneous G codes. The miscellaneous G codes capture a number of other healthcare encounters that do not fall into one of the other categories. Some of these codes identify the reason for encounter. Others are for use as additional codes that provide useful information on circumstances that may affect a patient's care and treatment. Miscellaneous G codes categories are G28 immunization not carried out, G29 encounter for other prophylactic measures. Okay, G72 problems related to lifestyle. So these are examples of miscellaneous Z codes. Non-specific Z codes. Certain Z codes are so non-specific or potentially redundant with other codes in the classification that there can be little justification for this for their use in the inpatient setting. Their use in outpatient setting should be limited to those instances when there is no further documentation to permit more precise coding. Otherwise, any sign or symptoms or any other reason for visit that is captured in other codes should be used. Examples are G02.9 encounter for administrative examination, G04.9 encounter for examination and observation for unspecified reason. Okay. G52.9 donor of unspecified organ or tissue. G codes that may only be principal or first listed diagnosis. The following G codes category may only be reported as a principal or first listed diagnosis except when there are multiple encounters on the same day and medical records for encounter are combined. Examples are G00 encounter for general examination, G01 encounter for other special examination. So these are few examples of G codes that may only be primary or first listed diagnosis. Okay. Pre-operative examination. A pre-operative examination to clear the patient for surgery is the part of global surgical package. Okay, this is very important point. A pre-operative examination to clear is to clear patient for surgery is a part of global surgical package. This is also important guideline. Pre-operative examination is a part of global surgical package and should not be reported separately. You should report appropriate ICD-10 code for pre-operative clearance, that is G01.810 to G01.818. Okay, if pre-operative examination is there, we have to select our code from category G01.810 to G01.818. Okay, and the appropriate ICD-10 code for the condition that prompted surgery. Okay, so if we are coding for pre-operative clearance, we have to choose code from G01.810 to G01.818 category, followed by the particular condition that prompted surgery. Okay. All claims for pre-operative evaluation should be reported using the appropriate ICD-10 code. These are examples. G01.810 is for pre-procedural cardiovascular examination. G01.811 pre-procedural respiratory examination. G01.812 pre-procedural laboratory examination. G01.818 other pre-procedural examination. So we have separate code for cardiovascular examination, respiratory examination, laboratory examination, and if your condition other than these three, you have to select code from other pre-procedural examination. Okay. So please remember this, that we have separate code for separate conditions of pre-procedure. Okay. If that surgery is related to cardiovascular, you have to select G01.810. If procedure is related to respiratory examination, we have to select G01.811. Okay. And if it is related to laboratory examination, G01.812. And other than all these three, we have to select G01.818. Next, social determinants of health. Just give a minute. We need some more time to complete this chapter. So next point, social determinants. Can you see my screen?
Yes.
So social determinants of health. We have still remaining 2 points, and then after we'll complete question and answer. So social determinants like economic stability, educational access and quality, healthcare access and quality, neighborhood and built environment, social and community context. So social determinants of health, SDOH codes describing social problems, conditions or risk factors that influence a patient's health should be assigned when this information is documented in the patient's medical record. Okay. Assign as many SDOH code as are necessary to describe all the social problems, conditions or risk factors documented during the current episode of care. For example, a patient who lives alone may suffer an acute injury temporarily, impacting their ability to perform routine activities of daily living. Okay. In such cases, we have to use SDOH codes, social determinants of health codes. When documented as this would report assignment of code G60.2 problems related to living alone. However, merely living alone without documentation of a risk or unmet need for assistance at home would not be support assignment of code G60.2. Documentation by a civilian or patient reported information that is signed off by a clinician that the patient expressed concern with access and availability of food would support assignment of code. G59.41 Food insecurity. Similarly, medical record documentation indicating the patient is homeless would support assignment of code from category G59.0 homelessness. So we have so many codes to indicate social determinants. Social determinants of health codes are located primarily in this G codes category. 55 problems related to education and literacy. 6 problems related to employment and unemployment. G64 problems related to certain psychological circumstances. G65 problems related to psychological circumstances. Other psychological circumstances. So these are a few examples of SDOH G course. And then last question and answers. While doing this, I'll show you how to find out these ICDs from ICD-10-data.com. Please follow the same and try to search using, okay? Dan is seen today for his chemotherapy treatment for his colon cancer of his transverse colon. So what are the appropriate ICD-10-CM codes? When you read any question, you have to be careful what is treatment and what is actual reason for encounter. Okay, so by seeing this question, we understand that encounter is for chemotherapy and for which reason?
Colon
cancer. And colon cancer, we have a particular part of colon cancer, transverse colon. Okay, so make sure that you are selecting code for colon cancer, transverse colon cancer. Okay, so because we have codes depending on location also. So by seeing these options, so you have to understand how to rule out the options first. Okay, if you are preparing for examination, you know how to rule out this course. Okay, so options. Now see here reason for encounter is chemotherapy. And just as we gone through guidelines that if the reason for encounter is chemotherapy, we have to use G51 code as a principal diagnosis, right? Correct? So you can see here in the C option and D option, they have given cancer code as a principal diagnosis, right?
Okay.
And this chemotherapy code as a secondary. So this is wrong option. So this is ruled out. C is ruled out. And in case of D also same condition. So D is also ruled out because they use G51.11 code as a secondary diagnosis. Okay. So in few questions you don't need to go and search for ICDs or CPTs also. By just doing rule out thing, you can came to find out your option. Okay. Now you can see here also in all the options G51.11 is used. Okay, so there is no need to go and search for because that is the correct one. All the options have G51.11 code. Just sequencing is different, and you have to search code for cancer. Right now we have ruled out this C and D. Understand?
Yeah.
Why we rule out? Because they use chemotherapy as a secondary diagnosis. So these two rule out, we have only two options, and in that also we know that in both the options G51.11 is there. Just we need to search code for colon cancer. Okay, we'll go and find the code. To select code for cancer, we need to go here. You need to go on table of neoplasm. Okay. Table of neoplasm. Inside the table of neoplasm, you will find index, alphabetic index again. We need to search for C and type here colon. I am typing here. You have to turn the pages and search for colon. Okay. So they just mentioned colon cancer, right? Not as a malignant or something. So we have to select this code, first code, malignant primary. Okay. As it is not describing anything, transverse colon or something, we have to go on this category, C18. Okay. And under the C18, we have to search for transverse colon. You can see.
So why should we go to C18 directly?
If you remember the category, you can go direct. Okay.
Okay.
You have to by heart this code. Okay. So, yeah. Now our location is transverse colon, right? So we have to select this code, C18.4.
Okay.
Don't worry if you don't understand this, how to find out the code for cancer, because it will cover in cancer chapter. We just see how to, which is the correct option. So A is the correct option. Okay, show you. I have to magnify this. Okay. So A is correct option, G 51.11 and C 18.4, because C 18.9 is for unspecified location of colon cancer, right? So this is more specific, C 18.4. That's why we selected A as our option, our correct option. Any doubt?
No.
Okay.
I'm okay.
So this is how you have to rule out the options.
Yes.
That you can quickly go through more questions. Okay. Next question. A patient presents for screening mammogram. She has no complaints. What is appropriate ICD-10 course? Okay. So again here you can see, as she is for screening mammogram and she has no any complaint. So obviously we have to use Z course. Right? And you can see here we have one option without Z code. That is B. So B is ruled out here. But between these three, it is confusing because all starts with Z12 category. So you can directly go on Z12 category also when you solving the question, when you are appearing for examination. But in case of when you doing your job, solving actual patient's report, in that case you don't have this option, right? You have to go and search for your ICDs. Or you have to, ultimately, when you gain more and more experience, you get by heart of this ICD. So now we'll go and see how to search this ICD and show you that only ICDs. So first we have to go on alphabetic index of diseases. Okay, you can see here alphabetic index of disease and search for screening. Please make a note of the steps of searching this course. Screening. Under the screening, we have to search for neoplasm. Okay, because the screening mammogram is done for neoplasm, right? Breast, we have to search for neoplasm. Okay, we got neoplasm here. And under the neoplasm, following the second line, we have to search for breast, because screening mammogram is done for neoplasm breast. So we have to search for breast. You can see here G12.39. Okay, but as this is routine mammogram, we have to select this code. So first try to search for specific code. If it is not possible, you have to use by default code. By default means like this. In case of this is by default, which is directly present after the main term. But here, as we have specification, this is routine mammogram. We have to select this code G12.31. Screening mammogram for breast cancer. Okay. In case of high risk patient with family history of breast cancer. So our correct option is A, G12.31. Okay. Clear?
Yeah.
Okay. Next. Child comes in for DTAP, TET and DPH, HIP A and MMR, and would be coded as, we have to search for this course. Okay.
Vaccination.
Correct. And vaccination course starts with?
So the B, we can rule out this B.
Yeah.
Because these are for pre-surgery. Yeah.
This also. A also.
Yeah. Yes. Okay. Yes.
So very good. Like this, you have to see how you can rule out the options.
Yeah. Yes.
So you can you have to search for less course.
C and D. Yeah.
As this is for immunization, we have to go on item and search for immunization. Okay. Sometimes we find our code under the immunization, or sometimes we have to go on. It's indicating that see also vaccination. If we didn't find our code under the immunization, we have to go and search in vaccination. Okay. So now, and as this is encounter for immunization, that's why we have to search for encounter. Encounter for. You can see here. Okay. You can see here approximate synonyms. Under the approximate synonyms, you can see diphtheria, tetanus, and other things.
Yes.
So here, the how we find out this code. Immunization. Under the immunization, we search for encounter for J23. Okay. During examination, you can directly go on the code and search for correct code. But I am showing how to find out this code so that it will be easy for you when you are doing your.
Okay.
Yeah. Next, physical documentation, physician documents that patient has been non-compliant with medications and has only been taking half dose to save on money. Okay, so this is something patient is not taking his medication to save money. So obviously this is something related to social, right? So
Okay.
it will not start. We can code this as with T code. Okay, so T code, because T codes are for poisoning, adverse effect, and all. So A will be ruled out. We have only 3 options, and all starts with Z91 category only. So you can go directly on Z91 category and search for correct code, or to search for this. As this is case of underdosing, we have to go on underdosing. And under the underdosing, you can find you have only few options. Intentional, as this is intentional due to financial hardship of patient. Okay,
Okay.
that's where we have to choose. This is our answer. Z91.120.
So I have a question here.
Yes.
So if I'm trying to answer the fourth question, so when the in the examination, so I have a doubt in this BCD. So I should go to this Z91.120 in the book to confirm this?
Yeah, you have to go and check all the options on which you have doubt. First, you have to rule out the options. Okay.
Yeah.
As we do here, A rule out, and you have to go on each and every code. But
so
it is always better. You are going to search Z91.120. Then you have to go on this code. Then you have to search for 3 codes, right?
Yes.
So it is always better if you go by track. Just I show you, tell you. It will be easy. So you can see when you are solving the mock test, you can see which will be easy for you. Okay.
I don't understand the point.
If you go and look for each and every.
Okay.
You have to go 3 times, right? And search for this.
Yes.
So it will waste your time. So it will be better if you go directly and just I tell you by underdose and then search for. After going on underdosing, that code easily.
Okay. So we can go for the underdosing in the book also, is it?
Yeah. You have to follow the same in the.
So I have to get practice to look over the book, is it?
Yes.
Okay.
You have to go through your book again and again and search. Try to search for different ICDs.
Okay. So the main practice is we have to do the all answers in the meantime, is it? Time management is important.
Yes, it's very important because you have to cover 150 questions in 4 hours only.
Okay.
And you have, I think, they changed the pattern. You have 10 something real reports also and few these small questions like this. Okay, so I'll tell you all these things afterwards. First, you just make practice of searching this course. Okay. Next question. A patient who has diabetes and hypertension comes in for pre-operative examination for carpal tunnel surgery. Okay, on the right wrist, And while solving your question, you have to highlight these terms for which you may need to search codes for. Like here, you have to highlight this diabetes, hypertension, pre-operative examination, and all. Okay.
No.
Examination is for pre-operative examination is for carpal tunnel surgery on right wrist, and the surgeon has ordered laboratory test. Okay, so what are appropriate ICD-10 codes? First, if we saw all the options, all options start with Z01 category only. Okay, and then all have this codes for diabetes. E11.9 is for diabetes, and I10 represent hypertension. You have to remember this codes, at least few codes. Okay, diabetes code, hypertension code, because they come frequent. We'll see guidelines for that. After that, you will get understanding of this course. But right now, this E11.9 represent diabetes and I10 is for hypertension. Okay. So all the options have this code also. Again, we have G56.01, same code in all the options. So these three codes we don't need to search for in this question. Understand? For diabetes, hypertension, and carpal tunnel, and all the options we have same codes. Just sequencing is different.
Yes.
Getting it? Okay. But right now the scenario is this: this surgeon is doing pre-operative examination, right?
Mm-hmm.
So our first diagnosis must be pre-operative. Pre-operative examination means Z01, something from some code from Z01 category. Okay, and then we have to use for which condition surgery is doing. And surgery is doing for carpal tunnel syndrome. Right? So our secondary code must be for carpal tunnel syndrome, which is G56.01. So now this is how we have to rule out the options. You can see in option A, it starts with Z code, then for diabetes, then hypertension, and then which is wrong sequence, right?
Yeah.
So A is ruled out. In B, the sequencing is correct. Z01, then carpal tunnel, then diabetes, and then hypertension. So this is okay. In case of C, again, the sequencing is wrong, right?
Yes.
C, and in case of D, the sequencing is same. Means correct. Z code, then carpal tunnel, then diabetes, and then hypertension. So now we have only two options, B and D. Okay, and we have these three codes same here in both the options. We don't need to go and search for these three codes. We just need to see which Z code is correct. Z01.812 or Z01.818. Okay. Do you remember? Just I told you, show you.
Yes. Yeah.
Which is the code? Trying to give answer or just waiting for you?
Okay, I think it's 818, the B.
No. Why it is wrong? I'll tell you. You can see here. Surgeon has ordered laboratory test here. Remember?
Okay.
Laboratory test. For laboratory test, we need to do 812.
812.
And I'll show you how to find out this code. You need to go on pre-operative examination. Okay. See, I have searched for examination. Okay.
Yeah.
Please follow the recording and follow the same steps in your book. Okay.
Sure.
You have to go in examination term and search for pre-operative. Just or so. Pre-procedural or pre-operative.
The laboratory is the 812.
The pre-operative or pre-procedural, we have four options. Okay. If cardiovascular is there, 810. For laboratory, 812 is there. For respiratory, 811 is there. And if specified, means other than these three, use 812. That's why you have given wrong answer. Okay.
Okay, I got it.
So you have to pay attention in all the details. Ordered for laboratory test. You missed this term, right?
Yeah.
So I hope this is clear for you now. So D. And here I have given all the answers also. Please try to search all these ICDs following the same procedure, same steps in from your book. Okay.
Okay.
Thank you for your attention and thank you for attending this class. Bye bye. Take care.
Okay.